You're arrested. You're arrested
I'm here with Dr. Randy Brown, who is with the University of Wisconsin-Madison Department of Family Medicine, and he did an evaluation of experience of participants in an operating while intoxicated treatment drug court. Randy, what did you do in this survey?
Well, the court was interested in evaluating from the perspective of participants how they were doing, in essence, and finding a bit out about which components participants found most useful. All the participants, 50 at this point, were folks who had been convicted of their third OWI and had had a breath alcohol content of 0.2 or greater at the time of the offense, or they'd refused it, trying to target a population that was at pretty high risk of being alcohol dependent. And these were all folks who'd been participating in the program of court appearances, treatment, supervision, and monitoring for 6 months. And we gave them a 43-item survey to ask them about what was most important to them about the program. Number one was having their jail sentence reduced, and 58%. But the thing that we thought was interesting was that while that was a prime motivator, the next two things of importance were participation in treatment and in group self-help. So that led us to believe that while the leveraging of the court was important, there was still a high degree of value placed on the treatment participation.
All right, so where are you going to go with this now?
The court is particularly interested in looking at some of the monitoring that's done. There are a few different ways that they do that, and they're struggling a little bit with which modality matches which participants. That can be phoning them to go into a location in the community for breath testing. There's testing that can be done through the phone line, or there's transdermal alcohol testing. And they're struggling a little bit with those things, who gets what and how to use the ignition interlock devices. So,
Any thought of using ethyl glucuronide testing?
that hasn't been done there. They're looking at piloting something called the EDAC, and I'm forgetting what that stands for, but it involves a panel of 20-some things that include some questionnaire items and some biomarkers. So there's interest in that, along with some other things to improve monitoring and how it's done.
Okay, all right. Very good. Thank you, Randy. Appreciate it.